Greetings, everyone. Thank you for joining us live. Every month, we host the Public Health Roundtable live on a different topic, but a similar group of people. Actually, the panelists sometimes are very different, but we invite you to join us. This month's topic is on conversations around diabetes awareness. Like, how are you communicating with the communities you serve or the community you're a part of about diabetes awareness? So, before we dive into all of that, I would like the opportunity to formally introduce myself, and then I'll have our panelists introduce themselves as well. My name is Dr. Charlotte Huntley. I am the CEO of Dr. C.H. Huntley LLC, which is an epidemiology consulting firm. So we support large nonprofit organizations that serve BIPOC communities, so Black, Indigenous, people of color, and we help them communicate their health information or data, epidemiology, in plain language to the communities they serve. And this may look a lot of different ways, like customized reports, community health profiles, a number of different types of deliverables. And this is what we get to do every single day. I'm also the host of the Public Health Epidemiology Conversations podcast. We've been producing new episodes every Tuesday since 2017. So if you have not heard about that, please do check it out. I'm going to pass the mic over to Erica next to introduce herself.
Hello, everyone. It is an honor to be here. Thank you so much, Dr. Huntley. I am Erica Horn. I am the CEO and founder of Akiri Consulting, and we have the opportunity to serve faith-based organizations, nonprofits, a lot of mentoring organizations, and help them with their health programming, whether it's a health fair, a symposium, bringing in education and training around a variety of health topics that may be relevant to who is in the room at that time. I really look forward to those opportunities. I look forward to working with these different organizations because it's a way to bring education that typically they may not receive, they may not have access to, into those spaces where it's typically not shared. So that's the amazing work I get to do with the Akiri Consulting. And thank you so much. And I look forward to today's conversation around diabetes awareness.
Thank you, Erica. And I'd also like to introduce you to, or have my next panelist introduce herself, Dr. Thelma Gamboa Maldonado. Please introduce yourself and tell us a little bit about you.
Sure. Thank you so much, Dr. Huntley, for the invitation. Erica, it's great to see you again. And hello, everyone. Greetings from sunny California. It's still morning out here. I am Dr. Thelma Gamboa Maldonado, and I wanted to share just a little bit about me. I'm a public health practitioner and consultant, and I have training and experience in governmental public health and academia. But over the years, I've learned and confirmed that my heart really is in working with community directly, either developing or training or working alongside with community health workers to deliver culturally tailored health promotion. And that's where I'm investing most of my time now. I'm really loving it. And I'm really also excited to hear more about our conversation. Thank you so much, Dr. Huntley.
Wonderful. Thank you for that introduction, both of you. Okay, so on our topic today, my question is, how are you engaging in diabetes awareness conversations with your communities? So again, this could be the communities that you serve through the work that you do, and it may be the community that you are a part of. It's open to either or, and I encourage you all to join in the comments. And for my panelists are going to kind of take turns sharing their perspectives. And I'll go first. I am an epidemiologist by trade, so I love talking statistics, and I think we're already aware of statistics in general. I'm choosing to be to share a personal perspective this time around. So, as a woman who is a diabetic, I was diagnosed when I was pregnant with my youngest daughter, and my youngest child. So I have three, and back then I was told, it's gestational diabetes. It'll go away once you deliver the baby. And it did not. And I remember feeling like I was caught in a whirlwind because I was a young mom. She was the youngest of three. So I had these three young children, and I was just handed this diagnosis. I didn't fit any of the criteria of what I thought diabetic looked like, using air quotes. Members of my family had diabetes. So for me, you had to be overweight and you had to be older to even be considered for diabetes, because that's the picture of what it was like in my family. And I just was in disbelief. And I did follow what I was told. I took my medicines, but I didn't really educate myself. I didn't really accept what was happening. A few years later, I started to really pay more attention. And as someone who's worked in healthcare and public health for over 25 years, I know that we focus on our communities and who we serve as a higher priority often than ourselves. So it took a while for me to really start incorporating some lifestyle changes and things that I needed to do for myself, some of the things I taught to other people and incorporate into myself. And also I've learned that different seasons of life, your body responds very differently to, what worked in my 20s didn't work the same in my 30s, didn't work the same in my 40s. And I'm going to stop right there. But it's important to pay attention to, just like we teach and talk to other people, with these conversations that I'm referring to that we have with, the communities we serve, the communities we live in. We're often having these conversations in our own head. I know I do. And it's important to make sure that those are good conversations as well. And then I also would like to share another story, a slightly different perspective. But when I cut my hair a couple of years ago in all natural and stay low like this, I started going to the barbershop. And I have a barber that I have a great relationship with. All of the barbers in the shop, when I go in, I'm welcomed in and it's a good community feel. And I noticed that there's one barber in particular who would start asking questions. It's always, "Hey doc, can you give free advice?" And I always know, okay, it's coming right after that. And he started to ask me questions about diabetes. And part of me was thinking about all the studies we've heard about where you go in the barbershop, you have the talks and the conversations. I even interviewed a guest on my podcast who led these, kind of certifications and trainings for barbers to be able to speak to community members. And I was just thinking, wow, I'm a part of what's really happening, what we talk about. And then the other part of me was like, I wanted to tell him all the things. I wanted to tell him all these experiences, what you should do, and like really lean in. But I had to be careful because everything I was listening. I was really listening. That's one of the things we know we need to do. It's not always easy to do because we get excited and want to solve the problem. But I listened, I paused and I listened. And everything that he talked about was based in his fear. He was afraid to get the diagnosis. He was afraid for the testing. He was afraid of what that meant. This is a young man and I would probably guess to say maybe his early 30s. And I remember being young with the diagnosis and it's very scary. So I met him right there and I just responded after hearing him speak for a while, and this is over multiple conversations that we would have. I would just address his fear. I would, let him know understood, expressing empathy and understood the fear. But I also had the opportunity to at least share with him just the other side of that fear, just a step on the other side of that fear, what it would mean if indeed he had that diagnosis, how much better off he would be to be able to get interventions, medications early, make some lifestyle changes, and what that would mean for him later in life. And I used myself as an example. And I had this little struggle. I wanted to go all the way with a lot of stuff, but I had to build that rapport and that trust with him right there. So we don't always get to see the end result. I don't know that he ever went to get tested. I don't know how far he went with it, but I know that we were able to have the conversation over 2 or 3 different conversations. I haven't seen him in a while, so maybe the next time I'll see him, I may say, "How are you doing?" and bring it up. But he allowed me in that space, and I was just very careful about the conversation. Of course, while I'm talking to him, all the people that are in the barbershop at that moment are listening. So I think that sometimes the way we would like to have the conversation is not exactly the way it actually happens. And the opportunity sometimes will pop up in places that we don't expect. So for me, it's just about, the conversation in my head and then the conversation in these kind of unexpected places. But I would love to hear from you, our panelists, and of course, all of you in the comments. Please share your own stories and situations. But Erica, let's go to you. How are you leading or engaging in diabetes awareness conversations in your community?
Thank you so much. I really love everything you shared, Dr. Huntley. I want to share 2 quick perspectives from where I get to have these conversations with family and through work. And so with family, I think about the many members in my family that are diabetic. And I'm also a doctoral student, so I always get a call, hey doc, what's this? What's going on? And my research centers around diabetes. And so like I have a lot of knowledge to share, but I'm also very cognizant of where they are, as far as being a Jamaican American, sharing information in a culturally responsive way, a way that they can understand, because a lot of the education that is out may not reflect what they're dealing with. And so I love the opportunity to share and have conversations around health, around diabetes, when it comes to like their medications, if they decide to take it, if they don't want to take it, and then just understanding the ways of life and holistic healing and wanting to take medicinal herbs and teas and doing different things, but also being able to share why they may want to consider medicines depending on the level of their A1C. But it's just a lot that I get to do in that space because they're just unaware, and it's not being brought down to a level of their understanding because the education sometimes isn't relevant to their experience. They're asking about food, they're talking about physical activity versus inactivity, thinking about their lifestyle in Jamaica and being here in America, living a more sedentary lifestyle. They're not as physically active. They're not walking miles to go to work. They're not going outside to get the food that they may have, be grown in their backyard. They may have to go to the stores to get all the processed foods, sometimes that's what's available. And so I really like the opportunity to just sit and listen to what they're going through, to be present. I know there's been times where I've just like flown home just to be with somebody who may be in the hospital. And the conversation isn't like, you need to do XYZ. So I understand wanting to hold back because of the wealth of knowledge you may have, but then also just being present, being able to advocate also in the medical setting for, to their providers. And so I get that. I love that. It puts me in a space to be able to understand, but it also helps me when I'm offering services to my clients. It helps me when I'm offering services at churches, when I'm speaking at like a health fair or something around the topic, because now I can assess the room. I can assess who's there. I grew up in majority of my church was Jamaican growing up. So when I'm talking about food there, I got to think about, we're not eating burgers and fries. When I'm addressing certain topics, it's the rice and peas you got to talk about, like how much rice and portion control. And so it allows me in my business to be able to be completely understanding of the community that I'm in. And I like that when I'm brought into a different kind of atmosphere, whether it's a church, whether it's a health fair, whether it's a mentoring organization, whether they're having some kind of health focus event, the education is specifically tailored to them. So there may be flyers that are created. It may be a conversation that's had. It may be a symposium. It may be a roundtable. It may be something one-on-one with individuals that are there present. But I get to speak to them about how this can overall affect their health and why they should also still speak to their doctors and like encourage them to go to their doctors. A lot of times that fear of, I don't want to know what the result is. There are a lot more people walking around with the diagnosis than they know because they just don't want to know that they have a diagnosis, because then there's going to be a responsibility on them to actually care for themselves and their health. And so trying to even break the stigma, I know we talk about stigma a lot around like, sexual health and around mental health, but even just the stigma around chronic illness and disease is something, because it seems normalized, people don't want to talk about it. Oh, everybody has diabetes, so everybody's going to get it. Everybody in my family had it. There's no need to address it now. I'll wait 10, 20 years before we talk about it. And it's like, no, let's have these conversations now so that we can address these barriers and try to ensure that everybody can live whole and healthy. So that's how I get to have those conversations, bring it down to like the youngest person, bring it to the space that they're in, make it relevant to the topic that we're talking about or relevant to the space that we're in, so that we can make sure that everybody's actually getting the education that they need. So yeah, that's what I get to do. And I do love it. Thank you.
Thank you for that, Erica. So many thoughts come to mind. I think it's important, especially when you say bring it down to the younger people. I think that they need to understand that it's not just an old people, disease. Like, that was what I embraced. And even some of the younger people in my family, when I talk to them, they're not thinking about that. It's not on their radar. So great point. And I think also I'm hearing this importance of of listening. That's just, we can't emphasize that enough, So I'm going to move over to Dr. Gamboa Maldonado. Please share with us, how are you having, diabetes awareness conversations with communities that you serve or the communities that you're a part of?
Mhm. Thanks for the question. And I think your testimonies and what you've already shared really does lead to what I wanted to share, and that is the power of stories, the power of people's narratives, and the power of sharing in community, feeling heard, feeling understood, not feeling judged, and hearing other people. And then that has an effect on us where we actually want to go and find out what's going on with me, because this issue of fear is a very big issue. And with diabetes, what I've learned through working with family members all the way until now is that while folks feel that this is going to come eventually, there's a sense of losing their identity, losing their autonomy. Like, you're telling me I have to stop eating my food. This food is what connects me back to my homeland. So why do I want to do that? So people, put it off. It's not something that, folks want to deal with. And I saw this firsthand in my family because diabetes has been a generational situation for us with my grandparents, my father, and then now my husband. And growing up, I always share the story that I was the original health educator or community health worker in my family because, my father would come to me and say, hey, I don't understand this information. It's in English. We spoke Spanish. And he's like, can you help me understand what I have to do here? Or how do I communicate this to my physician? Or how does this medication work? So from a very young age, I kind of had to learn how to help him so that he can advocate for himself with his physician. And so growing up, I knew that's what I wanted to do. I wanted to be a health educator because I wanted to merge that interest in health and in education. And so going through my professional trajectory, because we have that super hero mentality, like, I have the information, I want to help you. I want to protect you from making that health error or whatever. What I've learned to be the most effective way for me to communicate my message to community is to have an intermediary that is most connected with the community, and that is the community health workers. So the way that I engage in this conversation is through equipping community health workers to then go and transmit this message to our communities. So and I've done this in various formats. One is working with a nonprofit organization in Southern California, where we created a tailor-made intervention based on popular health methodologies. And so we were able to disseminate that really highly technical, possibly confusing information in ways that were very untraditional. So we use like poetry and song and photo voice and role playing and narratives to really not only understand, where people were coming from, but also to share that information in a way that was meaningful and useful to them. And also, as an educator, I do work with community health workers in the academic setting, and their training is a bit different. But the training I engage with my CHWs from the college is how to deliver this information in a culturally relevant way, really simplify, use plain language, and how to connect individuals to the resources that they need within their communities, and to really demystify this and destigmatize it, because it's scary, right? And really be their companion on their journey. So this is kind of how things have unfolded for me, and I feel like I'm being true to my original mission of being a health educator, and I'm really grateful for the opportunities that I'm able to share through CHWs.
Thank you. Thank you for that. You reminded me of a project I worked on. I think it got cut short for other reasons and external reasons with the client, but it was a state agency, and they specifically wanted to bring community health workers in to do what you described with diabetes prevention work within communities. These, in a very rural state. So these are rural communities. And I really, I'd almost forgotten about that component. Community health workers are such a valuable resource, especially with the communicating of information and health information, and they have a relationship with communities, so they're very strong partners. So thank you for sharing that and for bringing that up as well. I think the theme here, and we'll give one more round to our panelists so they can share their final thoughts. But what I'm hearing is the importance of storytelling, which I really am learning to appreciate more and more. I serve a lot of tribal organizations, and one of the things that stands out to me is, they're great storytellers, and historically, that's how data and information got transferred, and even in our communities and with our relatives, if you think about that. But one of the things there with this one particular client, and I sit on a small panel and with leadership, and so we repeat the same introductions. It seems like the same introductions, but every time she starts to introduce the organization and the history and what their mission, I get so caught up. It's like I've heard it so many times over and over, but I hear something a little different each time, or maybe it hits me a little differently. And I mentioned to her, because I saw her recently in person when we were at a conference in Minneapolis. And so what I'm sharing here with all of you and the panel and the community here is, I think our stories they're meant to be told over and over and over. And we may feel like, oh, I'm just on repeat, but there is a part of that that will fall on some people this time that missed it the last time, or maybe it falls on them at a stage in their life where they really need to hear it differently. It resonates with them differently. And maybe it's like, with me and my client, maybe they'll hear something a little different each time. So I think we need to remember that. We may think, well, I talked to them about this, I said the same thing last family dinner or whatever. But I think that when the opportunity arises, we also need to be comfortable in the storytelling and retelling. And that's how things really do, take root. So I'm going to pass back around one more time and let you share any final thoughts or that you'd like to share before we wrap up for the day. So Erica, to you.
I just want to say this was good. To Dr. Gambo Maldonado, it's interesting you talk about CHWs because I also am a CHW, so I get to work in that space. And they're so important. It's so important to just take the time to actually get embedded in the community, to listen to individuals, and to show them ways, help them to navigate the different barriers that are already in place that make it more hard for some more than others. And when it comes to diabetes, I think with it being so, unfortunately, so common, a lot of people don't take it as seriously. There's so many comorbidities that one can deal with. They can have to, deal with high blood pressure, high cholesterol, the possibility of losing limbs, the possibility of vision impairment, different kind of issues that can arise. And so I believe, honestly, having those conversations earlier, especially with those who may be new to the space, who may be new to where we're living at, and who may have different kind of language barriers, to helping them truly understand is so important, especially in this day and age. And I think as we continue to do the work, we'll continue to see the prevalence go down. That's our hope, that it will continue to go down, but really excited to be in this work, and so excited to see the work that you are doing as well. So yeah, be encouraged, share with somebody, it could be just, telling someone your story. It could be sharing the story of a loved one. It can be just sharing your personal story. It can be just sharing a fact sheet that you see. People are handing out a lot of fact sheets this time of year. And even if you don't feel comfortable, just even going to the link that's shared in the comments and sharing that with someone can make the world of a difference more than you ever know. So I just want to encourage people that it's okay to have these conversations, and we can easily address this growing worldwide epidemic if we continue to start having these conversations now.
Excellent. And what about you, Dr. Gambo Maldonado?
Yeah, the whole thing about stories and narratives, it's really central to the work I do now, and it's just central to our lives, right? The stories of our lives. And when working with communities, when you're just having a conversation with someone. You really never know what impact that may have. And there's such a myriad of different things or perspectives that you can take from, diabetes or any other condition. And you may feel like you're not an expert, so you may, be shy of even starting the conversation, but just listen. Just take some time to listen, take some time to encourage, take some time to connect. And there is power in that. There is power. Our communities, our patients and clients, if you find yourself in a situation where you may not have all the information, just hearing them out and just hearing what, some of their issues are, priorities are, what they want, to accomplish, you can help them navigate to what they need to get to, right? But that first encounter, that first time to just chat, having the tableside chat or kitchen table chat, it really has a big impact.
Yes, I agree with you both. Thank you for those final thoughts. And I wish we could continue the conversation because there's so much more that we could share here. But we try to keep the roundtable lives to, a lunchtime bite-sized bit so that if you're watching the replay or if you're joining live, we don't become a distraction. But a lot of really good insights and information shared on this episode. And we hope that those of you watching, listening will join the conversation. Like I said, share your thoughts, your ideas, but hopefully there's something that you've been able to take away from this discussion that you can, apply to help you have more engaging conversations with communities that you serve. So thank you all, and we will see you next month on the Roundtable Live. Thank you all, and have a great day.
Goodbye, everyone.